I'm Dr. DINESH HAWELIA, consultant dermatologist from Kolkata. I'll be talking about urticaria. Urticaria is a condition where the patient presents with red hives like lesions which may present from top to toe anywhere in the body. If they last for less than 6 weeks, we call it acute urticaria. If they last for more than 6 weeks, we call it chronic urticaria conventionally. And this acute urticaria usually resolves in a span of 2 to 3 weeks and usually mostly caused by either food or viral infections. So they are nothing to be worried about. You have to consult your dermatologist for that and he'll prescribe you the medicines accordingly. Now, if the lesions of hives last for more than 6 weeks, we traditionally call it chronic urticaria, as I mentioned earlier. This chronic urticaria again may be spontaneous. That means it may come on its own or it may be inducible. Inducible means it can be induced by certain environmental stimuli like temperature change, like pressure. We call it physical urticaria also. In this case, this physical stimulation can elicit hives-like lesions, and if we can avoid those triggering factors, this physical urticaria responds very well. Sometimes this urticaria may last for a few years also. So most of these urticaria, I mean chronic spontaneous urticaria patients, resolve by the span of 3 to 6 months. So you may have to take regular medication for this period of time, and usually this urticaria resolves. But in a small percentage of patients, it may last for 2 years or even up to 10 years. So you may have to take the medicines as long as this urticaria lasts. As a general measure, we should wear loose garments so that itching is not elicited, itching is not triggered, because if you start scratching, this physical urticaria can come to the surface. You should avoid sudden change in temperature. You should avoid scented soaps, perfumes, sprays, foods with colors, foods with preservatives. All these can incite urticaria in certain groups of patients. And if you can find out this triggering factor, avoidance of this triggering factor can reduce the urticarial symptoms. And you should always consult a dermatologist for these conditions, because he is the right person to advise you accordingly.